Hey guys, we are here today in Manchester. We are at Northern House Orthodontics, and we are going to get to meet Dr. Hesham Ali, who is a consultant orthodontist, and he works in hospital as well as in general practice, in a private practice, a specialist orthodontic practice. So let's go see what he's up to and get a little tour of the practice. So we're inside Northern House Orthodontics. Dr. Hesham, thank you for having us.
It's a pleasure. Thank you guys for coming along.
All right, so could you please just show us around the practice and take it from there?
Yeah, sure. So this is, as you said, Northern House. We're a specialist-led and consultant-led orthodontic practice. So we only do brace treatment and anything got to do with moving your teeth. This practice has been around for quite a long time. And there's a variety of different consultants working here. So we can cater for all different types of treatment, and we are mainly a referral-based practice. So we're here in sort of the reception area. Yes. This is where patients tend to check in and book in for their appointments. And separately, we have a bookings team who work in the back office to arrange everybody's appointments.
Yes.
So we'll show you the reception area here. And this is where sort of our patients just hang out and just wait for to be seen by their clinician. Yes. Yeah.
It looks really comfortable in here. I mean, people always fear going to the dentist. Hopefully that's changing now. But how do you find your patients are when they're sat in these chairs?
I think in orthodontics we're sort of blessed and lucky in a way, because most people historically have been sort of having that anxiety around having braces. There's been a stigma around having braces, but now things are changing, and patients, when they come in, they really are keen to be here. They're happy to be here, whether they've been referred via the NHS or here privately. They're here because they want to be here. So patients are motivated, and they don't have that much anxiety, and they're happy to be here. And then, of course, we have the secondary effects of social media and other direct-to-consumer brands which have increased the exposure and the visibility of orthodontics to the mass public. So when patients come here, they're happy to be here. They're really compliant with our treatment, and so we generally have a great experience for patients, mainly because, as I said, they're so motivated in the first place.
Yeah. Now, this is a specialist practice. It is a special practice because it's specialists. Some of them, or maybe all of them, are consultants as well. So just explain to us the makeup of that. What's different to this practice to what you'd get at a general dental practice?
Yeah, right. So in a general practice, you would have a team mainly led by general dentists. So they will have done their undergraduate degree, their BDS, and then they're normally working in practice for most of their lives. Within a specialist practice, we're only orthodontists, so that means we've done some additional training to become specialists, and then some more training on top of that to become consultant orthodontists. And that means that this team is led by a group of individuals or a group of consultant orthodontists that specialize in delivering brace treatment, and also have expert knowledge in the management of multidisciplinary cases. So those type of patients that require input from us as orthodontists, maybe from general dentists in terms of any restorative work, maybe from periodontists to manage their gum disease, and so on and so forth. So our team is led by consultants. Treatment is dictated and prescribed by consultant orthodontists, and we deliver that using a combination of the consultants and orthodontic therapists who deliver the care under our prescription. So that way we are able to see patients in a safe way and make sure they are seen on time, but they also have care that's being delivered at a very, very high level consistently.
Yeah, so I mean, this is where the complex cases get sent. The cases that us dentists can't really handle in general practice, they come into places like this. So, I mean, do you ever get easy cases because you're getting the cases that everybody else has said, you know what, we can't handle this?
You're right. You know, I think it's a really important point you actually raised there, because now with the advent of aligners and other sort of systems, I use that word sort of hesitantly, in general practice, we're seeing that dentists are picking up more and more orthodontic treatment themselves. And that means that from that entire group of orthodontic patients, more of the complex stuff is presenting to general patients, to general practitioners, who are then referring it our way. So I would say that over the years, the patient cohort that's being referred here is definitely more complex in terms of their care needs. We still do get the more straightforward cases, and that is really stuff that we can sort of treat in a second nature kind of way. We don't even have to think about what the plan is. It just comes to us, much like breathing and walking. So we get some straightforward stuff, but you're right, a lot of the care is difficult and complex. And I suppose it's because we are consultants here, and we do accept referrals wherever we're working. So naturally, it comes with the territory to have a large proportion of your patients being multidisciplinary and complex. It just comes with the job.
And would you say that most of the simple cases are maybe self-referrals, or is it actually even dentists are sending you simple cases?
I suppose it depends on your definition of simple. And so simple would mean different things to different people. So for me, simple is driving my car from A to B. But if you're Lewis Hamilton, simple probably means it's a Formula One car on a Sunday afternoon or a Saturday afternoon in a practice session. So simple means different things to different people. For the most part, I think the simple cases, I think it's a mix, to be fair, because what's being referred to me from general dentists might still be quite simple for me. It may be complex for a non-specialist, but for me it's still fairly simple. And equally, we get a lot of patients just self-referring, either through our own practice website or through my own Instagram. They get in touch with us. So I think it's a fair mix of both avenues.
Yeah. The patients that are in this waiting room, what sort of questions do they have for you? Is it the common ones of how long is it going to take? Is it going to hurt? What sort of questions do you get?
I think the patients who are presenting for a cosmetic reason or have a less complex management have those typical kind of questions. So how long is it going to take? Is it going to be off in time for my sister's wedding? When can I get my whitening done? It's those kind of cosmetic time-based questions. And the ones who are being referred to us, they are, if they're being referred for more complex stuff, they tend to have questions around the mechanics of the treatment, around the risks and complexities of the treatment. So when will my implant be done around the orthodontic treatment? I've got gum disease, so what does that mean for how you're going to treat me? Is there risk of tooth loss here? And questions along those lines, which are, I suppose, more health-based questions rather than more cosmetic or time-based questions.
So yeah, maybe if you show us to one of the treating rooms.
So this is one of the side surgeries. It's where our orthodontic therapist tends to work. And it's just connected through to the main surgery there, to the main suite. So what happens is that if you're having a treatment here with a therapist who works in sort of that team mechanic under our prescription, we can just nip into the surgery really quickly, make sure that everything is going okay, that your treatment is progressing nicely. And it's just a really convenient way for us to work and use that skill mix.
So maybe go into that a little bit more, because I don't think people understand the diversity within a specialist practice. So you mentioned therapists. So what's that working relationship? How does that work?
So an orthodontic therapist is someone who first works as a dental nurse for several years and then goes through a period of training to gain a diploma in orthodontic therapy, and that's done with the Royal College of Surgeons. So what that is a skill set which they gain to be able to deliver orthodontic treatment under the prescription of a prescribing dentist. So for example, Arnold, if you were to see me as a new patient today, I might do your clinical assessment and we'll agree a treatment plan. And then when you come back to have your treatment done, you may see my therapist to start delivering your treatment. And so the treatment is never prescribed by the therapist, but some of it can be delivered by the therapist. So you'll see me and the therapist routinely every few weeks to have your treatment delivered in that safe and effective manner. And what it means is that maybe you don't like me that much. My therapists are way nicer than I am anyway. So sometimes the patients prefer to see them anyway.
Yeah. So okay, I was going to ask you that, do some patients, they want to see you, you're the orthodontist, they don't want to see anyone else. Do you ever really get that, or are people pretty understanding?
I think people are quite understanding, and it works in two ways. I suppose the first thing is that if you do want to see a consultant only for all of your treatment time, then there might be a premium associated with that. And the second part of it is that by working with a therapist, it means that I'm able to focus on key aspects of treatment delivery, which I think that are, maybe best delivered by me as a treating clinician. And so my time management from a clinical point of view and from a patient care and delivery point of view is much better, because I'm just able to focus on those important aspects of treatment. Because we've worked in this way for quite a long time, to be honest, I can't really remember a situation where anyone has ever been at all querying why they're seeing a therapist or they're seeing me. Patients are quite happy to work in that way. And certainly, I think, given our track record of results and very, very low complaint rate or problem list, so I think patients are really happy, and it's been very effective for us.
I love how orthodontic practice is set up like this, and I don't think it's the same in different sections of dentistry. I mean, do you have any thoughts or ideas why it's within orthodontics that this setup where you've got therapists, orthodontists working together has worked so well? Was it always the case?
I think, thankfully, I've not been around long enough to answer. So, I mean, I've been working for a decade and a half or so. And yes, for the duration of my orthodontic career, we've always worked in this way, utilizing a skill mix. So we have nurses who are trained in taking impressions or scans, and similarly, the therapists are trained up in delivering the treatment. Our nurses take all of our x-rays. I could not tell you the last time I took an x-ray myself. And it's because my nurses are so good at it that I don't really need to. They are trained up in doing photography. And I suppose that just represents the kind of way in which we work. We have minimum requirements to satisfy at all time points. And if we're going to work efficiently, if we're going to work effectively, then we need to use a team approach. So, for example, you guys have this great podcast that you're doing. Now, if you did everything yourself, just imagine the man hours you would need, and imagine that you would need so many skills in so many different areas to make it effective for you. So similarly in orthodontics, for every patient, there has to be a clinical assessment. There has to be radiographs. There has to be study models. There has to be photographs. So those are the 4 key elements of any assessment. So if we are able to delegate some of those tasks, it means that we can get on with the bits which no one else can do. And so that specialization of labor helps to make things more efficient. And also, when someone is doing something repeatedly, they become excellent at doing it. And so from a patient experience point of view, it's great if you're seeing someone that is taking photographs day in, day out. They're going to be really good with retractors. They're going to be really good with their camera and the photography setup. So your experience is going to be much better as well.
You could take us to the next
room. Of course, come on through. So this is the main orthodontic surgery, or the main orthodontic suite. It's probably my favorite room in the practice, and you can see why. It's a really big space.
Very big space.
The patient sort of enters from that door in the corner, and then we often have a little consultation at this table here, which is a nice way to have a discussion with the patient away from the main dental chair, away from any area of anxiety, away from any materials or noise. So it's a really nice spot just to have a chat with your patients and get to know them a little bit better. And then when they move over, we do a clinical assessment in the actual chair. And it's a really nice, calming, peaceful environment, because from the window you have this really beautiful sort of green garden view. So in the summer we have sunshine and greenery, and in the winter we've got sort of a white layering of frost or snow. Either way, it looks really nice. So I think it's a nice environment just to work in. And for me personally, seeing a bit of greenery just puts me in a good mood. Makes you almost feel like you're outside. So yes, it's a great space.
A lot of things are clicking for me, because it's no wonder people love going to see their orthodontist, because the whole setup makes for a great patient journey. So even having the patients sit by the chair, they're not going straight into a dental chair, you're building that rapport. You've set up, with the garden, the greenery, the space, Yeah, I just think orthodontists have cracked onto something, which definitely works.
I think we're very lucky here that we have the space and set up in this way. I think it's a credit to the practice principals who have invested and made sure that actually the surgery is nicely laid out, that patient experience is taken care of, because you don't get that in every practice. And we were discussing before off camera about picking the right practice and how you find a job that's nice for you and how to be selective. And that's one of those things, is looking for principals like we have here who identify and understand those things. And that means that their patients are happier and the associates who work there are happier, and generally the practice is going to be more profitable. So I think it all ties in hand, right?
Yeah, no, I totally agree. So I want to just unpack that a little bit in terms of picking the right practice. So I'm going to ask you, different layers to this question. So for the orthodontists that are just newly qualified, they're looking for general practices or specialist practices to work at. What advice would you give to that? And then for the nurses who want to become nurses in an orthodontic practice or become orthodontic therapists, it's competitive to get into these spaces. So what advice would you give to those?
I think it's the same principles that apply to, I want to say almost any job, but specifically any dental job, okay? I think it's important to know who you're going to be working for and with. So if you have an established relationship with people, you've known them for a while, perhaps you know them outside of work, not necessarily as friends or family, but you might just know them through some other connection. You understand their personality type, then that gives you a good idea of the kind of place that you might be entering into. And of course, you never really know anyone until you do work with them in an intimate way, in terms of having a financial agreement with them, having an associate agreement with them, because things can change at that point, right? But it's a good idea to know who you're going to be working for in advance. Whereas if you're going into a practice blind, you never really heard about the principal before, you have no feedback from other colleagues who may have left there or who are currently practicing there, then you're not really sure where you're getting yourself into. Whereas if you know the person in advance, or you've got feedback from people who've been around that practice, and that's one thing to look out for. I suppose the second thing to consider is, if you're looking as a nurse to get into a practice, is, well, what is the skill set that this practice is looking for? And what does my current CV look like? So maybe you need to have a look at your CV and think about doing an impression course so you can help out on that side of the practice. Maybe you can do a radiography post-qualification so you can help out on those side of things. So look at the skill set which you currently have and then compare that against the CV of someone who might already be at that practice and try to match it up, or one better if you can. And finally, I think for orthodontists or even general dentists looking for experience in orthodontic practices, sometimes it's good to get into a practice which has a sort of a high volume of patient care. So maybe it's an NHS practice, and that way you can harness your skills because you're seeing a much higher volume of patients. You can see patients repeatedly and practice those techniques and refine those techniques more and more. So I think those are some of the key things I'd probably be looking for.
Nice. And what would you say you enjoy from treating patients, seeing patients? What would you say are the highlights for you?
Do you know, I have to say that the highlights for me definitely relate to those complex cases that come in. And I've got a couple of cases on the go at the moment where I just can't wait to finish them, because they're those cases that you treat once in 10 years or once in 15 years that come along, and you know that this is going to change a patient's life. And a lot of these cases are actually people in their 40s and 50s who've waited decades to have something done, and now it's their time to shine. So for me, it's around those complex cases where the management is multidisciplinary, the problems are multidisciplinary, and it's my responsibility to sort of deliver the bulk of the patient's care. So at the end of that really complex journey, you get into a result which is great, where it almost doesn't look like the same person anymore. So I think for me personally, it's the results around the complex care patients.
And working with the different staff members, what do you enjoy about the therapists you get to work with, the nurses you get to work with? What do you enjoy about that?
I think dentistry, you probably agree, Arnold, it's quite a solitary profession. We're sort of used to this silo working, where you're sort of in your own space and it's just you and your nurse. and all day you might not see any of your other colleagues. Now, me personally, I'm quite a social person. You know, I like to just be with people. I like to engage with people. So when I get called into my therapist's room to see the patient with her, I just enjoy that interaction with my colleague. I enjoy even just seeing that patient and saying hello to them, finding out what's been going on with them since the last appointment. So for me, it's that interaction more than anything else that I love, because it's great. You know, it means that you're constantly seeing someone else. You're stepping out of your little silo, your little bunker in your own surgery, and you're just getting to meet other people. I think it's just good for the mind, just to step out of that space once in a while.
Yeah. Show us none of the other rooms that you've got in.
So just through here is the other orthodontic therapist surgery. So it's much like the other side, where it's just connected to the main orthodontic suite. And yeah, we got garden views in all of these rooms, so it's always worth having a look at that. So yeah, that's the other surgery.
Yeah.
Set up in much the same way.
That's it. And how many clinicians or orthodontists work in this practice?
You know, I can't remember off the top of my head, but there's around 10 or 11 consultants who work here. And it's because we work in a sort of, not quite a shift pattern, but we're always, as consultants, trying to balance the time we spend in hospital as NHS consultants versus the time we spend maybe in primary care. So because we're spending 2 or 3 days in hospital, it only leaves a day or so where we can come to the practice and spend some time here. So most of us will be here for a day and spending the rest of our week in either doing other ventures or working in the hospital environment. So there's quite a large number of consultants. In fact, I don't think there are any other practices in the Northwest at least that have that number of consultants in one place. So it's quite a unique place to work.
Yeah. So, I mean, give us a little bit more insight into that. As a consultant orthodontist, you know, is it a setup by design where you're working in the hospital as well as in private practice? Is that something that you always wanted to do both? You know, why is that the case?
For me personally, yeah, I think it's something which it is by design. In the hospital, things are a little bit different because we're treating mainly the patients with a high treatment need. Who require constant multidisciplinary care. So it'll be the orthognathic patients who require some form of orthodontics and jaw surgery as part of treating their facial deformity. So jaw surgery patients, we're treating patients who are congenitally missing a lot of teeth, so hypodontia patients. And we might be treating patients who have a normal orthodontic treatment need but are complicated by different medical histories. So maybe they have a particular form of a bony metabolic disorder, they're having medications, maybe they have autistic spectrum disorder. So in that way, the hospital caseload is very challenging and very diverse. And so being in the hospital ensures that you maintain that skill set. It's also highly rewarding. You know, being able to treat someone who's maybe they have quite a severe form of autism, who find it difficult and find it laden with anxiety to visit the dentist, to see them over a 2 or 3 year period and give them an outcome which is life-changing for them is very rewarding. You don't get to do that outside the hospital environment. It's very, very rare. So, you know, or someone comes in with, let's say, Down syndrome, and I know I'm picking the more extreme cases here, but those are the ones where actually you feel, you know what, these people really deserve my attention and my skill set, and that's what you're trained to do. So being in the hospital gives me those benefits, which is great from a job satisfaction point of view. On the private practice side, it's a slightly different environment. So you step out of your hospital shoes, and it's nice because you get to work in a different place. So you know, everyone goes through a time where maybe they're going to work and they're not liking that place of work. So it's nice actually that on a Thursday I'll come here and I'll have a nice day here, and vice versa. Maybe I'm having a bad time here because something's going on, and so I can go to the hospital and I'll have a nice time there. So it works both ways. And I guess from the patient cohort point of view, we are treating a different type of patient here as well. So it's a different type of treatment, and I'm able to use appliances that I can't use in the hospital. So I'm using ceramic or cosmetic labial appliances. Maybe we're doing a lot of the Invisalign or aligner stuff, and we do incognito lingual appliance. So that's like a custom made brace, a fixed brace, which fits on the inside or the back of the teeth, so you can't see it. So those are sort of innovations that we can utilize quite readily in the private practice environment, whereas actually implementing that in the hospital environment might take quite a long time. So there's a range of reasons why we want to split our work up. But on the balance, looking at how happy you are with your job, putting all your eggs in one basket is never a great idea. So just split it up a little bit. I think it provides for a nicer balance to your working week as well.
What would you say for the orthodontist that's now transitioning into working in a private practice? What challenges might they face? What might make it easier for that transition?
I think, when you're working in private practice, if the majority of your clients are adult patients, that's one of the key differences to how you've been trained as a specialist orthodontist. With adult patients, there are lots of challenges, such as tooth wear, periodontal disease. Adult patients have had decades to harm their teeth in one way or another, whether that's through their own biology in terms of perio, or whether it's through not looking after your teeth so well and having lots of fillings and crowns. So adjusting to how you treat adult patients and managing their expectations, but also managing the treatment delivery, is something you have to get adjusted to very, very quickly. So have it in your mind that it's not necessarily a bed of roses. Adult orthodontics is highly complex, and to do it well, you have to have an excellent understanding of orthodontics at its core, as well as a good grasp of the restorative implications of any of your work. So I think that's the number one thing is be aware of adult orthodontics. And I suppose from a second point of view is make sure you're in a practice where if you are only there once a week, there are arrangements for those patients to be seen if there's any emergencies or problems. So I'm here once a week, for example, but while I'm away, if my patients have an emergency, they have a broken brace, or their aligner attachment has come off, there is someone here during the week every single day to look after my patients. In the same way that on a Thursday when I'm here, I will look after my colleagues' patients. So that facility is really important to ensure it's there so your patients are looked after and you're not stressing out on a Monday because you can't see your patient until Friday.
Yeah. And what would you say in terms of orthodontists specifically building their reputation? Because if you're newly qualified as an orthodontist, you can be heavily relying on the practice that you work at. But like yourself, you mentor, you teach, you've got your social media presence. How can a new orthodontist start to really develop that referral?
I think you hit the nail on the head there. I think you summarized it beautifully yourself, which is that you just have to do things outside of what was traditionally done by orthodontists. So traditionally, you would become a specialist, you would set up a local practice or have a job in a local practice that's already set up, and you just start receiving referrals. But with the advent of aligners and with the uptake of aligner treatment from general dental practitioners, orthodontists are now seeing that actually they need to do something else to attract referrals or attract patients. So either that means marketing externally through paid marketing, or it means raising your own profile through those different avenues, like doing some CPD events and delivering some webinars like I did. I did quite a few webinars in lockdown, just because I was kind of getting bored, and it was a good way to raise money as well for all the lockdown charity stuff, or for the earthquakes that were going on at that time. So do those additional things to reach out to dentists and build that network, build those connections. And I think almost in any industry, more important than your clinical ability sometimes in terms of defining your success is how well you can make those connections and how you can build your network. So it's about just making yourself visible and making sure that your local dentists know who you are and how you can help them deliver treatment, patient care in a joint way as well.
Yeah, I totally resonate with that, because I'm thinking about who do I refer to in terms of orthodontics, and when I look at people I can see who are visible on social media, you're probably the closest one in terms of being based in Manchester. I can't think of any orthodontists in Preston who actually have a page that I've seen or follow.
Yeah.
There's another orthodontist in Preston who the practice I was at, they referred to him for NHS treatment. So that's another orthodontist I would refer to. And there's one where in Garstang, they've got a referral practice where we went to a lunch and learn. So again, the people I refer to are people that have made themselves visible in one way or the other.
Yeah, you're absolutely right, and I think I know the Garstang practice. I know the other one in Preston as well, and they're good orthodontists there. But you're right, you just have to make yourself visible in some way, and I don't want to say it's a shouting match to say who screams the loudest or who waves the tallest, I suppose, but it's just about connecting with your local dentist and adding value to their work. So, for example, if you're referring a patient to me, Arnold, you might say, "Oh, this is a complex case, Hesham," and you might have a look at it. And once I finish the case, there's a good chance I'll be referring back to you to say, "Hi, Arnold, I'm all done. Please crack on with the restorative phase now to end this patient's treatment and finish it all off." And so there's a way of working synergistically so that actually the patient's getting the best orthodontic component, they're also getting the best restorative component from the referring clinician. So working in that team environment, helps in-house, but also externally, having that team environment supports patient care and supports growth between clinicians as well.
Yeah. What would you say it means to you to be an orthodontist?
What does it mean to be? I don't know. I just don't know. I think it's such a tough question. For me, I think I like orthodontics because it's probably not what I expected it to be, put it that way. It doesn't have a huge amount to do with traditional dentistry. It has a lot more to do with material science, physics, engineering, that kind of stuff. And if you just take all those components and then plug it into a biological context, that's what orthodontics is. And I enjoy all those things. So from an early age, I enjoyed those subjects. I have great spatial awareness. I understand geometry and physics really well. So that's why I enjoy orthodontics. What does it mean to be an orthodontist? I think it means that you have to have, number one, an excellent standard of patient care. You have to have a high level of drive or high motivation to get to where you want to go in orthodontics, and you have to have great forward planning or vision. Because with orthodontics, it's the one thing where I would say you need to know exactly how you're going to finish before you ever start. So excellent planning and forward vision is really one of those key traits, I would say.